After meeting and greeting the patient, I'll take them through to the clinical area. I'll tell them about the assessment and what it's going to entail and invite any questions from them.
So what do they do then? We just receive a referral?
Once they've given their consent to the assessment, I'll then start to take a history from them.
Send back to legal in general.
I'll ask them about their problem from when it started, with details of any treatments or investigations that they might have already had. I'll ask them to tell me about their symptoms, the location, what aggravates them, what eases them.
And that's here?
I'll give them a questionnaire to rate their pain, and I'll also give them a functional questionnaire, which allows them to indicate what they think they currently can and they can't do. I'll show them a booklet containing drawings and descriptions of various activities, and they'll then rate their capabilities on an answer sheet. Because I'm assessing them for work, I also need to know the details of their job. So I need to know what postures they're going to be in at work, what movements they have to do, what weights they have to lift, and how frequently they have to do those things. Once I've collected all the subjective history from the patient, I'll then start the physical assessment. I'll take their blood pressure and their heart rate to check they're fit for this. I'll carry out a clinical assessment in order to determine what's wrong, or in some cases to rule out that there is any serious underlying pathology. Once I know what the underlying pathology is and the job that I'm assessing them for, I'll then select the appropriate tools in order to assess their function. The first thing I'll look at is range of motion, and I've got inclinometers to help me do this. These are like spirit levels, and I'll place them over the body part that's being assessed, and then ask the patient to move as far as they feel comfortable. The inclinometers will then sense the movement, so I can take a recording of it.
And again, bending forwards.
And the inclinometers can be used to measure any joint in the body. Next, I'll look at muscle testing. So the patient will be positioned for the muscle group to be tested, and I'll ask them to push as hard as they feel comfortable against the pad and record the forces they generate. Next, I'll look at hand function, starting with hand grip. The patient will be asked to grip as hard as they feel comfortable, and I'll record the forces that they generate. I can also look at the precision side of the hand. But this time I'm asking them to pinch as hard as they feel comfortable.
So, pinch. And then one more time.
Dexterity is also an important function for the hands. So the Purdue pegboard asks the patient to sequence components, and I'll time them whilst they're doing that. So it will give me a speed for their dexterity. Depending on the physical demands of the job, I'll need to look at things like stepping ability, squatting, kneeling, crouching, reaching, sitting tolerance, standing tolerance. When I look at manual handling, I'll look at static lifting first. So the patient will be positioned for the lift to be assessed, and then asked to pull up against a bar as hard as they feel comfortable. The forces that they generate will then be recorded, and this allows me to look at what they feel comfortable and safe lifting. Once I know what they can do statically, I can go on to look at dynamic lifting, where the patient will be moving a load between 2 points. Weight will be incrementally added to the box till either the patient reports that they've reached their maximum, or until they alter their biomechanics, which tells me that they've reached their maximum. Once I've completed the assessment, I'll then put all of my findings into a report. The report will focus on comparing the patient's demonstrated functional capabilities against the identified physical demands of their job.